Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today before this holiday weekend. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm doing well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing our latest COVID statistics as well as the latest news and research through today, July 3rd. We invite you to submit any questions or comments down below or via any of our social media linked in the description. Starting with that COVID statistic. Average COVID deaths per day in the last reported week were down to 28 daily. In the same week in 2024, we saw 46 daily COVID deaths. Your reactions to those numbers, Dr. Murphy?
Yeah, they're kind of at the bottom. I don't expect them to go much lower than this. It would be great if they did, but this could be the bottom. We typically see a peak, a summer peak in August. So we'll see what happens if this comes again. It's happened every year so far. It'd be really interesting if that did not happen. But, you know, we're kind of at the bottom, but it's still 28 per day, and it's still better than 2024.
Mhm. And now that we're in that lull, if we look back at the last respiratory season, there's been some new analyses and data showing the efficacy of the COVID vaccine that we just got. Can you break down those numbers for us?
Yeah, so in the 23-24 COVID vaccine was very effective. And this is a big study which included 345,000 emergency department and urgent care encounters and 112,000 hospitalizations in adults across 230 hospitals, 362 emergency departments and urgent care centers from a variety of states really around the country. So it turned out those of them presenting with kind of respiratory illnesses, 9% were positive for COVID. So that's a good chunk. Now, they didn't have the history of prior COVID. That doesn't often show up in the record that they looked at. So, but they did have the vaccination data. So in the first 180 days after vaccination, the efficacy for emergency department and urgent care encounters was 49%. And for critical illnesses, like ending up in the hospital, it was 51%. And critical illness, 68%. So the vaccine really, this is pretty good. So what of really big interest in this study is that the protection kind of disappeared after 6 months. If you look at the whole year, it's effective. But in the last 6 months, it's not effective. Matter of fact, the rates were slightly higher in the vaccine group. In other words, it wasn't working at all. So it shows you how you have to keep up with these. No matter how many vaccinations you've had, you need to catch up with them. You keep up with them. Now, again, it doesn't take into consideration whether how many times you've had COVID, because that adds more protection. It's like another vaccine. So unvaccinated people do much worse, and the vaccinated people do better in the first 6 months after the vaccine.
Mm-hmm. And another important reason to keep up on those vaccinations and keep yourself out of the hospital is a new analysis that looked into some cognitive decline related to COVID. Can you tell us about that data?
Well, we know that cognitive decline, long COVID, this has been talked about quite a bit. We know it's real. We don't know really how much there is. So the Mayo Clinic was doing another kind of study altogether where they were looking at very specific cognitive function testing. Not just like your typical visit to the doctor, okay, but very specific measurement of cognitive function in 3,500 patients enrolled in an arthritis study, the Atherosclerosis Risk in Communities Study, or ARIC. And They looked at this from 2016 to 2022. This is one of the big NIH studies that's going on. And what they found was, well, cognitive decline is normal in older people. I mean, it slowly goes down. But if you had COVID, your decline was much faster, more rapid in the testing that they did. So it's very specific testing. So we don't know really how relevant that is, what it means clinically exactly, but it's certainly not good to have a cognitive measurement tool look worse. So if you got COVID, it you did worse. So again, it's just another kind of fact to that maybe can help people make a decision whether they want to keep up with these vaccines, every 6 months or so. But it can preventing COVID slows down cognitive decline.
Yes, and it is very positive that we are seeing those lower COVID death numbers. But even if you are not getting that severe of an illness, you still can have these poor side effects. So it's important to keep in consideration.
The other good thing about this study was that if you just had COVID and you didn't end up in the hospital, there was no difference. So you had to get really sick from COVID. And that's what the vaccine does the best.
Absolutely. Now, another illness that we have been talking about nonstop here in the United States is measles, and for very good reason. Cases continue to go up. Can you fill us in on what happened since our last update?
This outbreak, it doesn't look like it's slowing down very much. 4 more outbreaks, the little clusters of patients. The national total went up 27. And most of them are related to this big outbreak that's going on with the multiple sites. So there's been 27 outbreaks in the United States so far this year. So, we're like halfway through the year. And all of 2024, there were only 16 of these outbreaks. This is like going in the wrong direction. And they're getting reported from everywhere. Texas, Kansas, New Mexico, Utah, Michigan, Florida, Kentucky. So, it's really, really, when those vaccine rate drops for measles, this is what's going to happen. This is the new standard. They can't stop it. It's just kind of everywhere. It's such a contagious disease. And remember, people die from this. There's still the 3 people who died.
Mhm. Absolutely. Make sure you are up to date on those measles vaccinations. It is something that you can check. If you were born before the year of 1957, it is assumed that you and everyone around you had the measles, but you are eligible to get an additional shot if needed.
Even if you had measles and you took the shot, it's not going to hurt you if you're unsure.
Now, something that we are tracking very deliberately are the funding cuts in some of our global health partners that we work with and a lot of our other partner institutions work with. One of those big groups is USAID. There are new estimations and analyses done to show what the damage of those funding cuts could be. Can you tell us the numbers?
Well, to put this into perspective, USAID has been supporting HIV diagnosis, treatment, and care since George W. Bush started PEPFAR. It's been enormously successful, and it's saved already 92 million lives, including 30 million preschool-aged children. I mean, it's been huge, the most successful public health campaign in the world. Because HIV is a very, very difficult infection. It's forever so far, and you have to take medicine every day. Now, there's new medicines coming out. Maybe you can take a shot every 6 months or so, but for all practical purposes, you're taking a pill every day. It's been remarkably successful. To pull the plug on this program abruptly causes giant hole in the entire system that is now projected to cause, instead of saving 92 million lives, now 14 million excess deaths are going to be caused by this decision. Now, it could have been tapered out over a year or 2 years or 3 years or something like that. I mean, you could have wound it down, get the other partners energized. This is not like you can't flick a switch and treat or untreat these many millions of people. So it's just tragic and it's cruel and it's completely unnecessary. And we're just going backwards with this. And I don't think people realize this staggering number of avoidable deaths is because of this one decision. The system was up and running, it was working. Yes, we could have weaned out of it faster, but okay, you can't do it overnight like this. And we're going to pay the price with lives lost, including many, many, many children. It's really sad.
Yeah, it's disastrous, excuse me, cruel, tragic, and just not something you ever want to see, ever. But something, at least on a brighter note, is more Kaiser Permanente study data finding the efficacy and success of maternal flu vaccination and that effect on the newborns. Can you tell us that data?
This is a very timely study because, recently we've been getting some guidance from the Department of Health and Human Services about all sorts of vaccines and, pregnant women, don't have to take this or that. Here, Kaiser Permanente has looked at 245,000 infants born to pregnant women in Northern California in their insurance plan. And what they looked at was the women who in the second or third trimester who got the flu vaccine. There was a reduction in flu in kids, the babies born, of really almost 60%. A very similar study in Japan, not quite as many people, but still another big study, showed that there was a 73% reduction in flu-related hospitalizations. So, with these tens of thousands of pregnant people, taking the flu shot in the second or the third trimester is not only beneficial for the mother, but is beneficial for the baby. And really very nice analysis with just huge numbers of babies and looking at hospitalizations and even death.
And more good news regarding these next flu vaccines. There was a recent press release from Moderna regarding the efficacy of their upcoming flu vaccination. Can you share those numbers?
So they have a recombinant vaccine, so it's not made with the eggs and everything, the old-fashioned way that's been going on for decades. And they found that it was 26.6% more effective than the approved annual flu shot from GSK in adults 50 years of older in this study. And this is like over 40,000 people, and it's better. So, I mean, it's just encouraging. I mean, it's not as good, it's actually better than the standard vaccine. So, as we use the new technologies, determine that they're safe, and look at this efficacy, I mean, this is really, really great news.
Really great news. And one of the reasons that's so important and why the flu vaccine is recommended for everyone 6 months and older, even though the younger and the older groups can be the most susceptible to that severe disease, is that there's new data coming out specifically on working age adults and some potential harm from the flu. Can you tell us about those results?
Yeah, no, they show that this recombinant vaccine used in working age adults, stratified by age and everything, showed, a significant reduction in hospitalizations, outpatient visits, which means you're taking time off from work and everything. And they projected that fully replacing this vaccine with the standard one that we use in this older group would have prevented 88,000 hospitalizations over the last 10 years. So it's approximately 9 or 10,000 per flu season. So that's a huge number, and it's just it's just an advance. It's just important to show that we're making better vaccines, that we've got tens of thousands of people treated. I mean, it's safe. It's safe and it works.
Very good news. And our final story for today is a quick check-in back in on Cambodia, where there have been a couple more avian flu infections in humans. Can you tell us about those cases?
Yeah, so the Cambodians, they had reported 6 cases last week and 5 of them had died. Now they got another 4 cases. So they have a total of 10. 6 of them have died. So, I mean, the number is small. They don't test everybody. So it could be biased sampling where they're only testing the sickest people, but still, of the 10 cases, 6 have died. This is like, you know, we've had one death, from avian flu in this country documented. So something to keep our eye on and make sure that we keep up with the surveillance around the world with these potentially deadly diseases.
Absolutely. And 2 of those 4 newer cases were found through that routine surveillance, looking at the contacts of previous infected individuals. So it's good that those public health measures are working and are in place.
It's absolutely they're now finding them. So because they're looking at the other cases. So the more you look, the more you find.
Mhm. And on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise, bringing us all the latest data and helping us understand all of these very important stories.
We'll have a very good July 4th weekend.
Thank you very much. Yes, have a great holiday weekend to all of you. Thank you for watching. We hope to see you next week. As always, if you have any questions or comments, please feel free to leave them down below or at any of our social media linked in the description. Happy holidays and have a great weekend.
Take care.